right, here we go. Whew. What's up, everybody? Mark and Sarah back for another episode of Able Today. This is disability journalism where we tell stories, we hear stories, but more broadly, we communicate what's going on in the disability community. Sarah, we've got two amazing guests coming on today. But before we do that, let's talk a little bit about what's been going on in the news. What you got?
So, and I think two of our guests, I'm really excited. We have some Kansas Cityans on this episode, Mark,
Here we
and
go.
you're going to introduce them a little bit more formally in a bit. But one of the hottest topics in the disability community right now is the elimination of what we call 14C in policy wonk terms. It's a 1938 law, 1938, so 80 plus years old. A relic of what I like to call the New Deal, the Fair Labor Standards Act of 1938, that still legally allows people with disabilities to get paid sub minimum wage or pennies on the hour. We've even had some sheltered workshops that have been essentially caught paying people with disabilities in gift cards. I can't think of a more discriminatory practice. And there's some federal legislation that has some legs. I've worked on it for over a decade, called the Transition to Competitive Integrated Employment Act, because that's a mouthful, Mark. And then in Kansas, our governor just signed a bill. It has a number, SB 15, if you want to look it up. But what that does, it allows $1 million of new funding to go to the 17 sheltered workshops we have in Kansas to voluntarily move away from this outdated practice. And I think we're going to hear more about how Job One is moving away from this practice on the Missouri side.
I love that. And then, to the point, I think more broadly, this is a trend that we're seeing across the country, right? Like this is something that should have ended years ago. And like many other things, specifically in the able world, it's something that's finally being addressed. From the disability perspective, I'm glad to see that people are making the steps to make progressive changes. We need more of it. We need more of that energy. We need more compassion. We need more understanding, and we need more advocacy. So, from my vantage point to all of our listeners, again, I would encourage you to stay civically engaged, to understand how these legislations impact you, and to continue to lobby for better.
Couldn't agree more, Mark. Should we bring on our next two guests?
Yeah, why not? Let's bring them on. Sarah, let's welcome today's guest, Aaron Martin, who is the president and executive director of Job One in Kansas City, and Ann Hochstein, who is Job One's chief operating officer. Aaron has been with Job One for more than 12 years and more than 30 years working with people living with disabilities. It's fair to say he's an expert when it comes to knowing about providing employment opportunities and community services for individuals with disabilities. Ann has been with Job One since 2014. And when she was promoted to chief operating officer, she was charged with assisting and developing a new strategic plan. This plan aligned services and laid out a path to transform Job One from a traditional sheltered workshop to a multifaceted community services organization supporting adults with developmental disabilities to live meaningful lives with a focus on community employment first. Job One has a straightforward mission, which is to build skills and connections that create employment opportunities for people with disabilities. Welcome, Aaron and Ann. Aaron,
Thank you.
Aaron, please tell us a little bit about Job One and the difference it's been making for people living with disabilities since, 1967. Sarah, I stole your question.
You stole my question, and I didn't even get to welcome my two friends from the Kansas City region, Mark, but you're more than welcome to always steal my question. We won't bore you with any Chiefs Super Bowl talk. We'll just dive right in and let Aaron talk to us about Job One and what makes it unique. So, Aaron?
Sure. Well, thank you. Thank you for the opportunity to talk about Job One. Yeah, we've been around since 1967, and our roots are in the sheltered workshop program. So, if you go back 50 or 60 years at the time, parents got together and were looking for opportunities for their children, their adult children, as they were leaving the school system. in a time where there weren't a lot of other services, to have a meaningful day. And at that time in the 1960s, Kansas City was primarily a manufacturing economy, as was a lot of the country. And so parents, rightfully at the time, set up the sheltered workshop program. And it has been a model that has evolved and changed quite a lot since founding. We've been through a lot of different iterations over the years, over the decades at Job One. But I think the one thing that's always kind of set us apart, even going back to the 1980s, was that there was always an attempt at Job One and our predecessor organizations. We are the product of a merger that took place in 2012 between a couple of different local sheltered workshop corporations. Was just always the idea that one size doesn't fit all. And so what's happened over the years is the mission has evolved. Job One has managed shredding operations. We've had a corner retail store. We've had recycling centers. We've done a lot of different things over the years with the goal to, employ people in a way that makes sense to them, and also to increase wages, to try to help people make as much money as they possibly can. Having been at that constant struggle for years and years and years, by the time, I think Anne came on the scene about a decade ago with her great operational and strategic skills, we were in a place where we certainly were primarily a sheltered workshop corporation even a decade ago, with about 300 individuals working in 3 different workshops around the metro area. But with the enactment of WIOA, that kind of really started to sort of affect us around 2016, 2017, things started moving very, very quickly. And we realized that because of all of the community-focused programs that we had always had at Job One, we were in a really good place to start really implementing a strategic plan that would eventually, a decade ago, we didn't know when, but we knew eventually we wanted to move our services, and we wanted to align them more with federal disability policy, which is that people receive services in the community. And over time, Anne has built a team that has helped us get to that point where I think we've kind of done a 180, where we've gone from 350 people, about 300 of them in sheltered employment, to the point now where we're serving over 400 a year, and we're down to one small sheltered workshop in Independence where we're serving about 25 to 50 people a day. And so at the end of this year, we will be letting our 14C certificate, which allows us to pay some of the folks that we serve less than minimum wage, a commensurate wage. We are sunsetting that at the end of the year. So it's been a long-term goal of Job One, just to provide services that are relevant to people, that are meaningful for them, and that maximize wages. And I think this latest attempt to move away from 14C and into the community is just a continuation of what we've been doing for a long time at Job One.
That's amazing. And Mark and I've talked about this a lot offline and on the show. I mean, Aaron, and congratulations, because I think what the audience needs to understand is you're doing that voluntarily.
Right.
You're doing that in anticipation probably of the federal law or federal proposed law coming down. And Missouri has been one of the states that actually hasn't really been pushing a lot on that issue in Jefferson City. So that takes leadership and bold leadership. And I think both Mark and I commend you for that.
Thank you.
Absolutely. All right, Sarah, it's your question turn.
Oh, we're doing this. We're reversing it. Okay,
We're
so
reversing it.
Aaron, you talked a little bit about WIOA for our listeners that aren't as knee deep in legislative policy issues, Workforce Investment Opportunity Act. And we were seeing big, bold changes in WIOA in 2014. We were working on this when I was at NDSS in 2014. At the same time, we were leading the effort to help get the ABLE Act passed. So you came on board at Job One in 2014. Around that time, you started off as an employment specialist for organizations new in the community employment program, and obviously now serve as the COO. So talk to us about that employment, how employment has evolved and changed over the last decade. It's all local, and you're driving a lot of those local solutions for individuals. So talk to us about that.
Yeah. When I started at Job One, the board, as Aaron alluded to, we knew, the board knew that the move towards community employment was something that was important. But I don't think that there was a real clear path for what that was going to look like, because nobody at Job One had done the community services before. So I tell people I feel lucky in many ways that I was a little bit of an outsider. I didn't have a bunch of experience in this field, so I came to it with fresh eyes. And at that time in Missouri, the Missouri VR had adjusted their how they were asking us to provide services for supported employment to align with a more, more progressive, customized type model. And I didn't know any different. And we started providing services and got some good training through Griffin Hamilton Associates really early on. And by the end of that first year, we were having some successes. And so we were able to think about, okay, if we added staff, we could really grow this. But again, with the focus being that we wanted to, if WIOA was, and federal policy was pointing this way, we have all these people we're serving. We didn't want, if they raised their hand to go into the community, that we would have to refer them out. We wanted to be able to serve them ourselves because we knew them better than anyone else. We really, that's always, and there wasn't a lot of, timeline that like, we have to move people out of here in some quick way. It was more of that if Johnny says, I want to go in the community, that we are ready to support him to do that. So, as we talked about over this last 10 years, we have grown that program from originally just one employment specialist to a team of 10. We're serving more people in the community, just even in employment than in the workshop, but also now we've created some wraparound services like we have community-based day services, community networking that help people have a really truly meaningful day in their communities and help them reach their potential. So it's been really very exciting.
And I will say to follow up with that, Anne really did a good job of finding a model that I could live with and the board could live with, because we knew we had this population of people that had been coming to us many of them for decades. And the last thing you want to do is close programs or disrupt services when you've got people that are getting something out of them. And so the customized employment model was a really eye-opener for me, because I think that the folks that we have traditionally served in the workshop are people who sometimes do have more complicated needs. And that customized employment approach really is about spending a lot of time on the front end getting to know people and what are their connections and what's their social capital, what's their background, what are they into, can they get to work? All those important questions, all the things that traditionally had always made me somewhat skeptical of supported employment, because I'd seen the horror stories of people that were like, hey, Lowe's is hiring or McDonald's is hiring, go get Johnny a job. And that never really worked out. It was never a good outcome. And then people are stigmatized when they do go out and they have a failure. And families remember that, individuals remember that. And so Anne bringing that customized model to Job One was really, really important, because you see it work. You see people with more intensive needs that are getting the support they need on the front end. By the time they get a job, a lot of the things that would have created a job failure in the past have been worked out or mitigated. So it's a great model.
Or we're looking for a job that we've learned who this person is, what their skills are. So we're matching them. Maybe there is a job at Lowe's, but we know that's not the right fit. So we're just not going to go there. Where in the past, they're in a traditional supported employment model, where the jobs are, we just go apply. It's how many apps have you done? And that we know that doesn't work as well as one person at a time, really understanding who they are and what their needs are. So that seems like that's the secret to me.
No, I love that. And it to me, like, you took an intentional approach to addressing the social determinants of health that would otherwise prevent people from seeking employment, right?
Right.
That's incredible. Aaron, back to you. Job One in Kansas City has done so much to support people with disabilities, right? Clearly. Can you share some of your success stories in the region?
Well, I think I think with our just the numbers, the number of people that we serve, the longevity that we have, the number of connections that we have out there. But to kind of one thing that I'm really proud of again is, just one example of those. There's an individual that we serve who had been working in one of our workshops for many, many years, and great guy, but had struggled in that kind of an environment. And using that customized approach, and again, it's just one example of we were able to match this guy up with a local auto mechanic called Christian Brothers in Blue Springs, and just we have this great video that we'll share with you sometime. But the success story was really about customizing that approach and then seeing how much his life has improved since getting this job, what it's done for his self-esteem and his worth and his place in the community. It's hard. It's a hard question to answer because there's so many success stories. And when sitting where I sit within the organization, sometimes easy to lose sight of that. But it's really, to me, it's about those individual stories. Obviously, we're serving, 350 to 450 people per year. But I really feel like it's those individual success stories that I'm the most proud of.
Well, and Mark, we talk about this a lot too. We're talking about not just jobs, and I know you're just job one, but I finally feel like, and Anne, I feel like maybe your career journey through the last 10 years at job one, we're actually talking about careers for people with disabilities. Like we've totally shifted the conversation, the narrative, but the action, and that again can only be solved at the local level. Like we have to have the marriage between the individual, their passion, and the ability to support and meet that individual where they are. It's huge what you're doing.
And I can share a success story of a woman who had worked for us in the workshop, and it was also not a great fit for her. She was not happy in that environment. It was not great for her. And when she started working in the community, not only like that, it was good, it was successful. We used the word fading, like she wasn't needing job coaching anymore. But then like an opportunity came up for her to get a promotion, but we would need to come back in to support her and we did that. And now, she's in a more of almost a supervisory role in her world. And we're faded all the way back out again. And I think that's the difference with the whole customized model, because the business was willing to reach out and say, we would love to do this, but we need your support, because those relationships are bigger than just one HR manager who we talked to one time in an interview. It's a partnership. And I think that's what's exciting to me about what's really changed in the last 10 years is I think we have moved the needle with our business community to where those asks are normal. If that makes sense. And I think that's really important too.
That's huge. That's huge. And, I think, again, customized solutions, outreach, and making work is so important. Aaron, you and I kind of talked about this early on, but obviously our podcast here is centered around disability journalism and doing that through the perspective of ABLE accounts. And Job One, I know this because I helped launch the Missouri ABLE program many, many years ago with now U.S. Senator Schmidt. At the time, he was State Treasurer Schmidt. But talk to us a little bit about how the home state of Missouri is promoting ABLE and how you do that through Job One.
I'll let Ann talk to this one.
Okay. Yeah. Well, one thing that we have done about 3 years ago, we added a full-time benefits specialist on our staff. And I think that is really important. It's one of those things that is not fun. We're close. The state of Missouri has now added benefits planning under the waiver services. And we are hearing that VR is going to follow suit later this year. But up until now, it has been a totally unfunded service for us. It's something that we do because we know that it helps people make decisions about work because of what's right for them, and not out of fear, and not because they don't have all the information. And they know we're able to talk to them about the resources like ABLE accounts, about really understanding how their benefits would be affected. So they're not just going into a job interview with, I heard I can't work more than 20 hours, right? And so at Job One, that's how we've approached it, is by having trained staff who can really be involved in all those conversations. I know the work that's been done this last year to increase how much people can save and to change how Ticket to Work is happening in the state of Missouri. All of those things are going to have a huge impact long term for the people that we're working with. But if they don't know how it works or how to get the resources, then none of that matters. So,
and this was a huge it's always been a huge issue, especially in my world of running a sheltered workshop corporation, is when you did one of the first things you would hear when you would sit down with an individual or maybe their family and say, hey, your loved one, the person that you support, is telling us they want to try to maybe get a job in the community. And the first pushback was always, well, I've heard they'll lose their benefits if that happens. And just have somebody on staff who we can have them talk to that can dispel those myths and sort of alleviate some of that fear, and not only just give people facts, but also give them a pathway toward more independence. Because the last thing we want as professionals is for somebody to lose their benefits, especially with the population that we serve. It can't happen. So having that expertise in-house has really helped individuals, but helped us as an organization to do this really difficult task of doing this 180 of taking 200 or 300 people working in a sheltered workshop, making smaller wages, less money, and then having that transition take place to higher hourly wages. In Missouri, we've got almost $12.50 minimum wage now. And so how many hours can an individual work before those benefits start becoming impacted? And so it's real important on the front end before that person even goes out and gets a job that they understand that.
Absolutely. And we do a lot of national presentations. I get tapped all the time. I think I'm doing one on the state line on a Saturday coming up here, I guess the weekend, maybe after Easter. We see big difference. I want to come back to this question, the differences between Kansas and Missouri on where you sit. But the other thing that's so important to the ABLE community, and Mark and I preach this day in and day out, and that is research your in-state ABLE program first. And the tax benefits that individuals with disabilities and family members and caregivers that are contributing to Missouri ABLE accounts, where you sit on that side of the state line, are huge. Those benefits are incredible. And the fact that you're inserting ABLE into that benefits counseling is big. So Aaron, and maybe one of you could jump in, because again, I wanted to come back to this question, like, what are some of those big differences being a disability support provider organization that sits on a Kansas-Missouri state line?
Well, I think the challenge has been we have not yet added contracts in Kansas, even though we are literally, our office is a block off state line, because there are so many differences. And traditionally, with the sheltered workshop model, that's funded through state and through county. And when we added a Medicaid contract or Department of Mental Health in Missouri contract in 2018, we realized that opened us up to making it easier to provide, especially the community-based services in both states. But because there's such big disparities in the reimbursement rates and in all of those pieces from a business decision, we have not yet made that move to serve people in Kansas, because it doesn't fit our business model as it is currently. We're hoping, I know there's reform that's happening, and we're hoping that that's something that we'll be able to do probably in the next year or so, part of why we've moved into the physical location that we are. But I am not an expert on Kansas specifically, other than that while there is less, you can do more things in their codes. The way that they're reimbursing agencies doesn't allow you to pay a professional wage to the people who are providing the services, and so we aren't doing it.
Yeah, make that make sense.
Mm-hmm.
Yeah, make it make sense. Well, I want to wrap this up, because this has really been a great discussion. But I want to wrap it up with a really easy question for both of you. What's the best thing about ABLE accounts to you guys? Starting with you, Aaron.
I think it's just what it allows us to do, and it allows individuals to do, to have a more independent life. Just looking over the numbers today on the MoAble website, an individual can contribute up to $18,000 a year And then if they're working, an additional 14,500 to that. So we're talking $33,000 a year. And a lot of the population that we're serving aren't necessarily coming to us for a 40-hour-a-week job. And so this gives us a huge amount of flexibility that if an individual does want to go out and find a meaningful job and put in 20, 25 hours a week somewhere at a decent wage, above minimum wage, $13, $14, $15 an hour, they can put a good amount of that money away. I think it's up to $100,000 in Missouri, to be able to pay for all different kinds of things in their lives. So I think that, to me, that is the benefit, because it takes the pressure off us as a provider of worrying about individuals making too much money and negatively impacting their benefits.
Love it. And
Yeah, I think that's right. I think it comes back to having individuals be able to make choices not out of fear. Because when so often that's what we see when we don't take the job, or when mom and dad rightfully are worried about us even looking for a job. It's always about the fear of losing their benefits, and having the ability to shelter some of their funds that they've earned, so that they're not having to worry or do crazy things to spend the money that they've made on things they don't need right now, just so they can keep themselves within those asset ratios. That's the kind of stuff that we can now help them have a plan, versus just saying, well, it's just not worth it. We're just going to keep doing what we've always done. So
moving from what, Mark? What do we say? A monthly financial planning process to
a
a
lifetime.
lifetime.
yes.
Well, last thing, I know you guys have a lot of programming, a lot of activities coming up this spring. Aaron, I hear you guys have a big event coming up. You want to tell us about that?
I do, and I actually have a nice little card here. I don't know if you can see it, but we have a casino night coming up at Arrowhead Stadium. It is on April 19th at 6 o'clock, and it's going to be a fun night of Vegas-style games. All the proceeds go to help us do the great work that we do here at Job One, and tickets are available. They are going fast. We went from a smaller venue in Independence to Arrowhead Stadium. We had 200 people there last year. My last check, we are about 80% of the tickets are sold at this point. They're going fast. So if you want to come out, people want to come out and support what we do, I think it's going to be a really, really great time. Tickets are $150 each. We have sponsorships. There's information on our website. So if you're interested, feel free to reach out to me, jump on our website. We'd love to see our community there.
It's amazing. Well, we know it's going to go well. And Mark, that Arrowhead, that's where the Chiefs play.
I don't know anything about that.
The Super Bowl winners.
I don't know. We got a Superdome here, so.
Awesome. Well, and Aaron, we are so grateful to have you on our show. We look forward to more work together, and I look forward to seeing you just across the state line.
That's right. Thank you so much for having us.
And to all of our audience and everybody listening, thank you for tuning in for another episode of Able Today. Catch us next time. Cheers.
Thank you.